Right. Good afternoon, everyone. Thank you very much for being here. To start off this event on the UN Decade of Healthy Aging, Health for All by Adding Life to Years, I would like to invite Director for the Department of Social Determinants of Health, Dr. Etienne Krug from WHO, to start us off.
Thanks very much, Kazuki. Excellencies, ministers, colleagues, and friends, welcome to this discussion on healthy aging. I'm Etienne Krug, and I'm Director for the Department for Social Determinants of Health, which houses half of our work on healthy aging. The other half is housed with my colleague, Anshu Banerjee, who sends his greetings and will join us a little bit later. The UN Decade on Healthy Aging brings us an unprecedented opportunity to transform our world and to make it much more apt for people and future generations to live long and healthy lives. Fostering healthy aging takes government leadership, and therefore we are very fortunate to have with us several ministers who have taken action on this topic and will be addressing us today. I'm thinking in particular the ministers of health of Botswana, Costa Rica, Kuwait, Singapore, and Slovenia. A very warm welcome to all of you, and thanks for taking the time to be with us and sharing your experiences in addressing the 4 pillars of the decade on healthy aging. The ones on changing how we think, feel, and act towards age and aging, ensuring communities foster the abilities of older people, delivering integrated care and primary health services responsive to older people, and finally, providing access to long-term care for older people who need it. Before we get into debate, let me introduce our chair for this event, Mr. Ong Ye Kung, Minister of Health from Singapore. I'll hand you the floor just in a second from now, but before that, we were going to show you a video describing the decade, as well as providing statements from Dr. Tedros, our Director General, and Dr. Victor Tsao, the President of the US National Academy for Medicine. Thanks to both of them for providing the statements. Let's watch the video and then over to you, Minister Ong.
Your Excellency Ong Ye Kung, my friend Victor Tsao, esteemed guests, dear colleagues and friends. As WHO celebrates our 75th birthday this year, I believe our best days are still ahead of us. When we're supported to live longer, healthier lives, all of us can maximize our potential at any age. The UN Decade of Healthy Aging is an unprecedented opportunity to put in place policies and services that enable more people to experience good health and well-being in later life. The decade focuses on 4 areas of action: age-friendly environments, combating ageism, integrated care, and long-term care. It's encouraging to see many member states investing in programs across these 4 areas. To further aid these efforts, last month, WHO released a new guide on age-friendly cities and communities, supported by a toolkit for policymakers and other stakeholders. New evidence from the United States National Academy of Medicine shows that investment in healthy aging benefits all of society, which is why all of us should be actively contributing to the goal of improving the lives of older people, their families, and their communities. Together, we can make every year count. I thank you.
When it comes to aging, we can learn a lot from nature. Consider a tree. As it grows, its rings expand outwards, telling the years gone by. But those rings tell more than just time. If you look between the lines, you will also see how the tree's habitat and living conditions have impacted its life. The healthier the ecosystem, the more it will have thrived. We humans are no different. As we age, our physical and social environment provide us with vital resources: access to healthcare and proper nutrition, opportunities in education and employment. Safe housing and supportive communities become the roots that nourish our development and well-being. So what happens when we grow older if our environment does not sustain us? Just like a tree, our health declines and we struggle to flourish. Over time, we may become disconnected and a burden to others. The UN Decade of Healthy Aging aims to give everyone the opportunity to add life to years, wherever they may live. A transformative collaboration of diverse sectors and organizations, the decade focuses on changing how we think, feel, and act towards aging, cultivating age-friendly environments, creating responsive healthcare systems and services, and promoting long-term care and support essential to living with meaning and dignity. By adding quality to quantity, we give all people the chance to lead a meaningful life, no matter their age. And that includes you, and you, and you, and me. Together, we can make every year count, not by the numbers, but how we live and grow in between.
Director General Dr. Tedros Ghebreyesus, honorable ministers and colleagues, good evening. I'm Victor Zhao, the President of the U.S. National Academy of Medicine. Let me begin by thanking Dr. Tedros, the WHO, and the participating member states for supporting today's event, which is jointly organized by the UN Decade of Healthy Aging and the U.S. National Academy of Medicine. I would also like to thank the Minister of Health of Singapore, the Honorable Ong Ye Kung, for chairing this meeting. Population aging is an unprecedented opportunity for societies globally. By investing in healthy aging across life course and increasing health span, all people of all ages will benefit. To this end, the U.S. National Academy of Medicine launched the Healthy Longevity Global Grand Challenge. The Grand Challenge commissioned an important report called the Global Roadmap for Healthy Longevity. It is an evidence-based framework to capitalize opportunities presented by population aging and to help ensure health span matches lifespan. Healthy longevity will necessitate a multi-sectoral and equitable approach. So by advancing infrastructure to support population health and prevent disease through integrated public health, healthcare, and socio-economic enablers, we can leverage the human, financial, and social capital of older people to achieve a healthier longevity and healthier society. The National Academy of Medicine's approach complements the UN Decade of Healthy Aging's focus on ensuring healthier lives for current and future generations. I'm so pleased that member states can utilize both the UN Decade of Healthy Aging and the National Academy of Medicine's Global Roadmap to catalyze action and strive for health longevity for all. I look forward to future partnerships and collaborations in this very important area. Thank you for permitting me to welcome you, and please enjoy the session.
Excellencies, ladies and gentlemen, my name is John Wong from the National University of Singapore, and together with Dr. Linda Fried, co-chair of the U.S. National Academy of Medicine Global Roadmap for Healthy Longevity. It's my great honor to introduce Mr. Ong Ye Kung, Minister for Health of Singapore, who leads the Ministerial Committee on Aging and just released very important policy papers in Singapore on how we should address the issue of healthy longevity. Minister, please.
Okay, it's better. Thank you, Professor John. Excellencies and distinguished guests, thank you for the opportunity to speak at this event. The world is aging. It is affecting Europe, North America, Latin America, Oceania, Asia. Global median age increased from just over 20 years, that's in 1970, to now just over 30 years in 2022. In 2019, for the first time, there are more people over 64 than children younger than 5. In fact, people over 64 is growing faster than all other age groups in the world. The United Nations defines a country as super aged if 21% or more of its population are aged 65 and above. Today, countries such as Germany, France, Italy, Spain, Netherlands, Sweden, Portugal, Slovenia, Croatia, Finland, Greece, Latvia, Lithuania, Japan are already super aged. I'm not saying if you are 65, you are super aged. I'm saying countries with 21% or more of their population, 65 and above, are super aged countries. Yeah. Very important caveat. And they are mostly European countries now. By 2030, many more countries will join this category of countries. US, UK, New Zealand, Switzerland, South Korea, Singapore, with China coming very close. And by then, 60% of the world's population aged 65 and above will be in Asia. So this is a particular issue that Asia is, this is an issue that Asia is particularly concerned about. And this is a major social transformation, because in most countries, we take for granted how things operate. But actually, if you look at our labor market legislation, our old age social security systems, very importantly, our healthcare systems, they are all designed without an old population in mind. And now everything is changing. For example, retirement ages, they were legislated very long ago when people live till their 50s or their 60s. And so you have retirement age set at 60 something, which is actually higher than the average lifespan of people. And so to retire and have nothing to do is actually not a common occurrence. People die before they retire. That was at that time, post-World War I. And it is now common for people in many countries to live well beyond their retirement ages into their 80s or into their 90s. So how do we ensure that these large segments of retired population with 20, 30, 40 more years to go, they can live purposefully and with dignity after retirement? And related to that, how do we ensure that after retirement, our national social security systems continue to provide them with old age support and without burdening future generations with high debts? Our healthcare system is another system that was designed for young people or young population in mind, and is therefore focused on acute care, on curing diseases and treating diseases. How do we ensure that our healthcare systems with an aging population can continue to cope with rising disease burden and workload? Let me give you an example, an experience that Singapore is currently going through. In Singapore, our average length of stay in hospitals have increased by over 15% over the last 3 years. It used to be 6 days, and after COVID, it has suddenly jumped to 7 days. All of a sudden, 15% increase in length of stay. And these longer stayers are typically older with multiple illnesses and complexities. And longer average stays alone, within that short period of 3 years, have therefore added 15% utilization rate to our hospital wards. And this is just the beginning of the impact of aging. Our nurses, our doctors are all feeling that very acutely. Living environment is another example. For example, in the public housing flats in Singapore, when we were a young population, some of the older flats, you take 2 steps before you enter your apartment. Today, that 2 steps it's like 100 kilometers for an old age person on a wheelchair. 2 steps means either you're isolated or you can be out there with social groups. Just 2 steps. But we build them without thinking that we may have old people living in their apartment one day. So as I always say, it is like we have been training for the Olympics for the 100-meter dash. You turn up for the event and they say, sorry, you are registered for the marathon. And how are you going to retrain yourself and regroup your muscle groups? Aging is therefore a paradox. It resulted from our advancements in hygiene, medicine, quality of life. Yet, it is posing significant and potentially crippling challenges to many countries, to our population spread, social security, and healthcare systems. At the risk of oversimplifying the challenge before us, there is actually a silver bullet to solve this problem of aging, and that is to redefine aging. If aging can be redefined from 65 to 75 or 80, we solve the problem overnight, but we know it's not so simple. It is not just a numbers game. If our norms change such that people can work actively way beyond 65, stay healthy way beyond 65, we need to make major changes to our social economic systems and all our policies. Only if we do that, then we can redefine aging, and then the problem of aging becomes a blessing of healthy longevity. But it is not happening as quickly and as significantly as it should. Years and decades of work therefore lie ahead of us to bring that about. The first progress report in implementing the UN Decade of Healthy Aging, presented at this 76th World Health Assembly, informs us of the good work that has been done so far. The UN Decade of Aging Action Plan and National Academy of Medicine Roadmap provides us a good framework to guide us forward. I've read those reports. The areas of work are well spelled out in the reports, but let me just put them in sharper focus here. These are the areas of work. First, and what it means to work on these areas. First, develop age-friendly living environments. An older population requires appropriate public amenities, barrier-free access, road designs that slow down traffic, apartments that assist them in living, benches and covers so that they can go out and sit down when they are tired. This is especially given the rising rate of urbanization, which means rural areas will increasingly comprise older populations, and they have to be taken care of. Second, maintain economic vibrancy by leveraging an aging workforce. Retirement ages need to rise in tandem with longer lifespans if they are required at all. We need to harness technology to drive growth with productivity rather than injection of sheer manpower. Education, training, and evolving our attitudes towards our career with age will be key to unlocking this potential. Third, bolster national retirement adequacy. For countries with pension systems, there are defined benefits. Making this system affordable nationally with an aging population is a particularly stringent challenge. For others with old age support systems, there are more defined contributions in nature, such as Singapore. We will need to address the issues of lack of retirement savings. Either way, these are difficult challenges. Common to both systems are that if people can work longer and view a longer working life as something positive rather than a burden, retirement adequacy will be more secure. Finally, we need to reform our health systems. Beyond focusing on expanding our acute care systems, we need to strengthen primary care to prevent and avoid the onset of diseases. Primary care is the foundation to the resilience of healthcare systems against aging. It helps generate health in communities and in homes. It goes beyond tapping on the expertise of doctors and nurses, but also community stakeholders and families to get today's young and middle-aged to do the right things. Stop smoking, exercise, eat well, go for regular health screenings. Simple things that doesn't cost a lot, but will have so much savings and bring us so much happiness much later. But because we see it much later, many of us don't do it now. Much work lies ahead. What I mentioned are largely domestic occupations, but an international global conversation on this topic is necessary to enhance our understanding, to allow us to learn from each other, and allow us to cooperate in this very important challenge. I look forward to hearing from fellow member states and their experiences in investing in healthy aging. Thank you. Now I would like to hear from the ministers and representatives who have gathered here today from Botswana, Costa Rica, Kuwait, Slovenia. I hope your words will inspire us, give us insights on how investments in healthy aging are benefiting your countries. I would like to first start off by asking a question for Dr. Edwin Dikolotti, Minister of Health, Botswana. Dr. Dikolotti, Botswana has recently responded to the call of the UN Decade of Healthy Aging to improve the lives of older people, their families and their communities by making investments in developing a national healthy and active aging strategy, 5-year strategy, 2021 to 2026. To share with us why Botswana has chosen to invest in healthy aging, particularly from the perspective of a country that actually is relatively young. And what are your priorities and what got you to being so farsighted? Dr. Dikolotti.
Thank you very much, the esteemed moderator, Your Excellency, Mr. Ong Koon, the Minister of Health from Singapore, honorable ministers in the panel, and all ministers attending this session, and Your Excellencies, the heads of diplomatic missions and other international organizations, distinguished ladies and gentlemen, a very good evening to you all. I would like to express my gratitude to the organizers of this meeting and for inviting me to participate in this important event on healthy aging. Chairperson, it is true that more than 2/3 of Botswana are under the age of 35 years. However, in the recent years, we have noted a progressive increase in life expectancy from birth in the country from 51 in the early 2000 to 66 in 2020. 7.4% of our population, 7.4% of our population is currently over the age of 60, and this is projected to nearly double to 13.5% by the year 2050. This pace of population aging is unprecedented, and it is therefore for that reason that Botswana believes there's a need to take action to ensure that we are prepared to maximize the opportunities brought by longer lives, by making sure that these lives are also as healthy as possible. Botswana began to act even before the UN Decade of Healthy Aging was declared. In 2019, Botswana's Ministry of Health conducted a rapid situational analysis of older people's health in the country, of course with the support of the WHO. And this highlighted many gaps, including those related to policy and law, health service delivery, ageism, and poor data collection. It is then that we established a healthy and active aging steering committee with representation of diverse stakeholder groups, that is from diverse ministries, policymakers, from academia, human rights professionals, from the civil society, from religious groups, from traditional practitioners, and many more, to oversee further activities around healthy aging. This work is aligned with the UN's decade's call for multi-stakeholder collaboration to improve the lives of older people. And the declaration of the UN decade was a clear impetus to take further action on these identified gaps, and therefore a Botswana healthy and active aging strategy of 2021 to 2026, which is aligned to the UN's decade plan, which was developed. Through the strategy, we aim to create age-friendly environments. We plan to align national systems to the needs of older people, to develop a sustainable and equitable systems for providing long-term care, ensuring productive and healthy long lives. It is also a priority of our government to ensure successful implementation of this strategy. Some of the ongoing activities towards that include adapting and implementing WHO's integrated care for older people approach, developing an adult health monitoring card to help health and care workers to better identify and respond to the needs of older people in primary care. Above all, Botswana is committed to strengthening the people-oriented primary health care to ensure improved care along the life course, and it considers needs of the aging. With the evidence presented by the UN Decade of Healthy Aging Action Plan and new resources such as the US National Academy of Medicine's Global Roadmap for Healthy Longevity, it is beyond doubt that we stand to gain much more by investing in healthy aging, and we stand to lose significantly if we miss this opportunity to make sure that our lives are also healthier lives. We want to encourage our fellow member states to prioritize investments in healthy aging, which will benefit not only current generations of older people, but our younger generation too, who are the older people of tomorrow. I thank you.
Thank you, Minister Dikoloti, for sharing your work on healthy aging and your insights. The Singapore government always take pride that we practice anticipatory policy development. That means before problem arrives, we start to evolve the policies first. So I'm very glad to find a kindred spirit now in Botswana. I wish you all the best. Yeah. I would now like to continue the conversation by zooming in on how such investments work in practice and from a more sectorial perspective. We also have with us today Dr. Humoud El-Zubai, Director of the Department of Non-Communicable Diseases of the Ministry of Health, Kuwait. He's here representing Dr. Ahmed Abdul Wahab El-Awadi, Minister for Health of Kuwait. So, Doctor, Kuwait has been doing great work in implementing an integrated continuum of care for old people and promoting them aging in place, something that Singapore is trying to do. And how has this very person-centered, responsive approach to older people's care brought benefits to Kuwait, not just for your health sector, but for other sectors as well? Doctor.
Your Excellency, dear colleagues, thank you for giving me this opportunity to talk about the elderly healthcare services in Kuwait and share the experiences. Family relationships are an important aspect of Kuwaiti society. This means that ensuring the right environment for healthy aging affects not only the elderly individual, but also everyone around him. It also means that the process of creating the right environment for healthy aging, the process of ensuring effective nationwide care for elderly also rests on the entire community. This is why Kuwait is taking a holistic approach to continuum of care to accelerate progress during the UN Decade of Healthy Aging. The first aspect of this approach focuses on understanding the end-to-end needs of the individual receiving care. The second aspect of this approach include understanding the social and environmental factors that facilitate access to care and the impact of care on elderly population. The Ministry of Health Geriatric Department is leading a whole of government strategy based on a rich toolbox of interventions. First of all, WHO's ICO program has been established as a national program at the Ministry of Health. ICO provides a comprehensive framework that Kuwait is introducing at the primary healthcare level nationwide. In collaboration with the World Health Organization, the Geriatrics Department at the Ministry hosted an ICOP training in February this year to provide fundamental knowledge to health and social care workers in order to standardize the reorientation of primary healthcare services. We are now rolling out ICOP across primary healthcare centers in Kuwait, starting with a pilot study that will implement ICOP in primary healthcare centers, as well as assess current challenges and models. Second, the Geriatric Department is rolling out an extensive survey from across Kuwait that ultimately improves our understanding of the population needs and refreshes our data on elderly care across the country. Another example is Kuwait's ongoing work towards age-friendly health facilities across the country. This program will be introduced in 2024 and will build on the finding and leadership from the pilot studies, surveys, and training that are concluded this year. Kuwait is committed to this work and to working with WHO and partners to realize even greater gains in how the health system and health policies improve continuum of care for elderly. Thank you.
Thank you, Dr. Al-Zubai, for these perspectives around multi-sectorial nature of investments in healthy aging. Even though such investments begin with the health sector, it affects many other sectors. And I'm particularly impressed by the concrete examples you have cited on how you're making changes to address older population by retraining, by redeploying, reconfiguring your healthcare manpower, something that we can all learn from. I would like to continue this theme of the importance of taking a whole of society approach to fostering healthy aging and unlocking the possibilities of longevity. And on this topic, we'll be hearing a statement from Dr. Alexis Carrillo Villegas, Vice Minister of Health, Costa Rica, who until very recently was Acting Minister of Health for the country. And unfortunately, due to last-minute itinerary changes, Vice Minister Carrillo and his team could not be with us today, but they are keen to contribute to our conversation through a written statement to be delivered by my colleagues at WHO.
Distinguished Director General of the World Health Organization, Dr. Tedros Adhanom Ghebreyesus, and other representatives of WHO and PAHO, representatives of the United Nations, of the National Academy of Medicine of the United States of America, distinguished ministers, and representatives of health ministers that integrate this panel, ladies and gentlemen. Since the declaration of the Decade of Healthy Aging, 2021 to 2030, Costa Rica has assumed with national commitment the agreements that make up said declaration. The Decade of Healthy Aging represents a milestone that aims to promote health and improve the lives of older people, their families, and communities. In turn, the decade proposes the need to introduce fundamental changes, not only in the actions that people undertake, but also in the way of thinking around age and aging. For Costa Rica, this is a priority issue and a state commitment. The country is undergoing a marked demographic transition, with higher life expectancy and declining birth rates. National and PAHO projections on the subject show that by the year 2050, more than 20% of Costa Ricans will be 60 years of age or older. As life expectancy in the country increases, a series of situations are evident that deserve to be addressed by the state and civil society. Among them, it can be highlighted that 27.6% of older people live in poverty or extreme poverty, and that 3.1% do not have health insurance. In addition, 28.8% have disability, 37.9% live alone, and 16.6% do not have direct monetary income. The country has committed to guarantee healthy aging through national actions, as well as compliance with and integration of the areas established within the framework of the PAHO WHO Decade of Healthy Aging. In this sense, 5 pillars are highlighted in which the country, from the National Council of Older Persons, has sought to advance and hopefully serve as a regional benchmark. First, regarding compliance with the rights of older people, these are guaranteed in the Political Constitution of 1949, the Comprehensive Law of Older People 7935, Law 9857 on abandonment, Law 9394 on the Inter-American Convention, Law 9188 on strengthening of guarantees, and Law 7052 on housing. And so a diversity of topics including transfers, universal pensions, public transportation, tax charges, protection of human rights, equal opportunities, the Convention on the Rights of Persons with Disabilities, amongst others. Second, on the topic of cultural transformation. The country has conducted perception analysis, studies, and work agreements with university centers, initiatives to integrate the theme at the curricular level in the Ministry of Public Education, reinforcement of the National Information Center, the Advisory Council for Older Adults, in addition to various national campaigns. Third, for the prevention and the treatment of abuse, the development of a national observatory, improvement of the attention strategy, sensitization to the population, research on the subject, and publicizing rights and compliance. Fourth, on social protection, development of the National Aging and Old Age Policy and Plan, National Care Policy, expansion of the Solidarity Ties Program, strengthening of the care network, expansion of the monitoring and evaluation system, and strengthening of the National Care Network. And finally, fifth, on the topic of comprehensive health, a political impulse to preserve the blue zone of Nicoya, establishment of a national care system, a national plan to treat Alzheimer's and related diseases, expansion of the National Geriatric Service Network model, and strengthening of the structure and human resources in health. The Ministry of Health contributes to these pillars with different actions and initiatives, including the National Strategy for Healthy Aging based on the Life Course, whose first 2018 to 2020 edition already implemented, developed, and articulated work with the national institutions that make up the National Commission on Aging. As of the update of this national strategy, which covers the period from 2022 to 2026, the commitments are reaffirmed and extended to advance in the fulfillment of the objectives of the decade. This new strategy will be launched with great diffusion precisely in a couple of days on May 25, 2023. Additionally, Costa Rica since 2019 promotes and advances in the age-friendly cities and communities initiative of PAHO and WHO. It was adopted as an opportunity to promote healthy aging from the communities. Age-friendly cities and communities has meant the union of actors from an interinstitutional coordination table in which the Ministry of Health, the Institute of Municipal Development Advisory, the National Association of Mayors and Intendancies, the Board of Pensions and Retirements from the National Teachers, the University of Costa Rica, the National Council of Older Persons, the Yamuni Tabush Foundation, and the WHO National Office in Costa Rica. There are currently 24 cities attached to this global network, which are working on the transformation of their cities in order to be spaces more adapted to the needs of older people. Likewise, in 2022, the first National Congress of Age-Friendly Cities was held in Costa Rica, in which around 4,000 people participated as a follow-up and technical support to the participating municipalities. From the coordination table, a national guide was formulated, adapted from the WHO Vancouver Protocol, for the implementation of the initiative at the local level, and monthly training spaces are provided with tools for the corresponding focal points. Finally, the country is working on the formulation of the new National and Aging and Old Age Policy, which proposes 5 clear lines of action at the national level. In conclusion, Costa Rica has assumed and will continue to assume the commitment contained in the agreements of the Decade of Healthy Aging, implementing comprehensive policies and innovative actions, which include the active participation and contribution of older people with the aim of improving the quality of life and inclusiveness in the whole society. Thank you.
Thank you for that comprehensive statement. Now I would like to zoom back into a particular area that I think we are all concerned about, which is combating ageism. And we have with us Dr. Kerstin Vesna-Petric, Head of the Office for Cooperation with WHO, Ministry of Health, Slovenia, and the current chair of the WHO Executive Board. And I think we all have experience with ageism, where we know that someone who is older, maybe near or over retirement age, they still have something to contribute. They want to contribute, but yet somehow they are not getting the jobs or not treated fairly. And when you talk to employers, they'll say that their skills are outdated, they don't fit the culture of the company. So I think more conversation is needed in this area to bridge that gap. So Dr. Petric, I hope you can shed some light on it. But of course, with your vast knowledge, you can speak beyond ageism and on other topics on aging that you deem appropriate. Please.
Thank you so much. I was asked by several of you, why did you choose to come to this session? Well, I think that, here in this area, a lot of things needs to be done. And I'm aging myself, so I wanted to see what's going on, why still I can contribute. You said anticipatory. I want to anticipate a little bit here. And while I'm still in action, to contribute to solutions that will be good for me and for my country, of course, always. So I share with you something. When I was a young girl, I had always an eye for older people. So, and I'm speaking of people over 80. I like to encounter with them, listen to them, these old stories from before and so on. I really love that. And I never felt they were really old. I felt that they were old when they needed my help. While I was little, but they needed my help, I felt, okay, that is old age, you need the help of a child. So that is definitely being old. But last Christmas, my partner is geriatrician. So he asked my 2 children, they are in their late 20, 30, what for you is a young person? My son, 32, he says, 35, maybe 40. My daughter didn't say anything. What for you is an old person? So my son goes, 65, because his mom has been already 60, not yet 65, So there's a difference. And I think we have invested so much to promote youth that really made a difference. When I was young, we didn't promote youth so much, we didn't talk so much about being young and being old. So that is something that has changed. And this must be changed back, I think, but I'll talk about this later. So Slovenia, definitely my country, is an aging society. We understand this for a long time. We see this UN Healthy Aging Decade as an opportunity, especially us in health sector, because we do understand that us in health sector can do a lot. And several of you were speaking, geriatric services, long-term care, blah, 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 keep people healthy, because yes, in my country as well, we live longer, but this doesn't mean that we also live longer being healthy. And that is a problem. And we are investing in this with all sorts of preventive programs from children to old age. We have health promotion centers that are accessible to everyone. We take care of obesity, this and that, lots of programs. But you did say a lot of things that also exist in my country, so I'm not going to repeat this. We also discuss, that we should increase working age, like in France, from 60, 62, 65, people get seriously very upset. Why is it? Because they don't know, what that would mean. Are they going to keep the same jobs they have and be seriously not compatible with younger people? Because maybe the jobs require certain skills that, when you are a little bit older, you try to not be as good as you were before, So, and also, we are also discussing that, there are many solutions for this. And that has been going on for many years now, because we really are aging society. It's not something that will come. We are there. If you go to a rock concert in Slovenia, most of the people are over 50. So sorry, what are we speaking about? And here in Switzerland, I was walking on the street, and yes, most of the people were over 50. I don't know if it's Geneva only, but yes, we are really aging societies. So when we discuss solutions, we are talking of many things like, and we are talking of things that can be done by different sectors. So it's not just health. We don't focus only on health. One thing is preparation for retirement. And this means, the retirement already is something that, it seems like we will have to abandon this word, because, for example, my father, he's 87, he still works. My aunt, she's 81, she still works as a doctor. Father is professor, and so on. People tend to work longer, people tend to work longer. The problem is what occupation you are in, it's very difficult to have some repetitive work, very boring. So we have to pay attention, but you can maybe find solutions that at a certain age, you go for some other opportunity, but this needs to be supported, because when you are 60, you are not, I'm over 60 now, 63, and I was thinking of some other opportunities, but I'm careful, because what does this mean, But if people would support, some services would support me, encourage me to look for some other things I could do, if they would try to identify where I'm good because I'm more experienced, that would be helping me to change my, not profession, I'm a medical doctor, but maybe to change my post, So these kind of things. We are also of course, and I'm skipping this because others have spoken of this a lot, we are also doing a lot of strategic work. We have the strategies, and it's key here to understand, that you have to combine different strategies from social affairs, and then the strategies from, and when I'm speaking of social affairs, we have to pay attention to poverty, to social inclusion, and so on. Then education, it's very important that we support people that, they can increase their skills and knowledge even in their later stages, not only when they are young. While, of course, young people are more flexible and they learn faster, but, if you have experienced people, you can add on this experience certain knowledge, and that is very powerful. You can use these people for certain things. So this is what we are doing and experimenting a lot, and we are also eager to do something internationally. You know that being a small country, you depend a lot of what is going on internationally. And even if we are speaking of promoting youth, we cannot close our borders. Everything is on, the web, and people are affected by what is going internationally. So we will have to take in account, that we need to work together internationally and do something. And actually, I was talking to my ambassador this morning, and I said, I'm attending this session, and I had prepared more or less, what we are doing in health services and so on. But as I said, everybody was talking about this, and she said, yeah, Slovenia, Brazil, and Argentina, we want to promote that we need convention on elderly people, because there is convention on youth. And I was thinking, okay, that's fine, but I'm in doubt. And I'm now finishing, and I say why I'm in doubt. Because I think we have gone length to call people elderly, older, are they older, elderly, old, whatever. All these words are wrong, because I'm aging since I'm born, and you are aging, you are young, you are old, but you are not older person. You are not elderly person. Here it starts, because as I said before, my father, he still thinks he's super young. He's 87. It is how, if I called him elderly, he will be offended, so why are we using this wording? We are aging, yes, it's the fact. Aging brings some problems, medical and others, but also brings some advantages, so we should actually we should redefine aging. You said it. Let's redefine aging. And me as a medical doctor, I can clearly see a problem. A problem is medical. You can be sick or not sick, but you are sick young or you are sick old. So let's address the problems, medical problems, differently. I agree, it's very different. My partner is geriatrician. He always tells me how complex it is to address the same disease with an elderly person, as we call it, I cannot avoid that either, but he also tells me, that very often we deal with people that have a higher age in a way that is not appropriate, because we say he's 65, so should we transplant the liver or something, where's the limit? He says, it's not appropriate to make age a criteria. You should make the status of health a criteria, so not age, So this is really serious, and we should discuss this because, first of all, we should, I do think, stop talking about elderly and old people, My age, 63, I shared with you. So what I am, old, not old, middle, whatever. I'm healthy now, so I'm a healthy person, 63, looking forward to life. So that is a very important thing I wanted to share. And I want also, when I was listening to you, I could see, that we are doing a lot in health sector in particular, because we are trying to cope with the demands of people that, of course, that's the fact. Older you get, more diseases. Yeah, and sometimes diseases that are much more expensive to deal with and complex, So yes, definitely you use the word investing. We should invest in health services to be appropriate to deal with this complex, multimorbid, persons with multimorbidity, persons that are frail, persons that are for this or that reason disabled, So these kind of things we should address in health service. But we should also have policies that enable people that are, apart from their medical problems, capable to give something to society, and not just enable them, because it's not just about that. We should prize these people to contributing to society. So young people should understand that we are pricing people that are of age, to contributing to society. They can do a lot. I just wanted to share one thing with you, and I think I shouldn't skip that one. Where is it? Here. I come from, I'm as old as I am. I still remember how it was when we had a state-driven system, call it socialist, whatever. But it was state-driven, you know. That state-driven, it was about us, and you know, a lot, we could call it nanny state. A lot was, you know, decided by the government. So we had this or that, or we didn't have, but it was by the government. Now we have business-driven system, and I see this also as a problem, you know, because here in business-driven system, there is a tendency that young people get employment and there are no rules when they start or stop working. They tend to work more, longer hours. So what we see in my country is that before, people living together with grandparents, you know, they could even take care of them because they came home after 8 hours. And I said once to my daughter, I said, listen, I have taken care of my parents, you know, and my grandparents also, you know, so obviously I expect you will take care of me. And she said to me, Mom, the state took care of you when you were young because you got the flat, the education was free, you know, no worries there, but I have to take care of this, and then you expect me to take care of you and the children, and who else should I take care? So there is a huge burden on young people now to take care of their fathers, grandfathers, whatever, you know. It's really, I think we should pay attention here. I'm super worried that this will generate ageism because young people, you know, not being able to take care of older people. First of all, in Slovenia, there are fewer, so they will have to work more if people that are aging are not going to contribute. How are they going to take care of all of this and the families and so on? What are we going to do this? And many people speak of solidarity between young and old, but this solidarity has to be grounded on reality, not just words, you know. Everybody agrees, yes, we need solidarity between young and old, but look how young people live now. They are overburdened, really they are, as are middle-aged people. So we have to figure it out how we are going to deal with this. And that is why I thought this topic is super complex, very difficult. I'm thankful that we have a decade to figure it out, because in 1 year, no go. You know, we need to have a decade. You could see me struggling when trying to picture it up for you. You know, I didn't prepare like you did all the written statements. I hate written statements. I just put some thoughts on the paper, you know, but we are struggling. We are. And I see here not so many young people, but happily, I do see young people. I'm very happy. I would love to stay here a little bit longer, Samra, a minute or two, because I would really want to hear your voice. I really want to hear your voice. I hope that you will try to have some debate, because if we are ending here, I will be disappointed. Yeah.
You have to go.
I will have to go, but I'll wait for some response from.
Stay a minute, because I'll respond to what you just said. Thank you very much for that very interesting, very animated presentation, Dr. Patrick. I take away one major point from what you said. We have been talking about policies, practices, and all that, but I think you touch on something that you didn't use the word, but I think you touch on the very important issue of mindset. But once our mindset is someone is old, everything about the person is old. But we really need to move away from that mindset of young versus old. It has a lot, you use the word flexibility. I think it's like our joints. If we don't move it, it grows old. Mm-hmm. We stretch it all the time, we keep it flexible, it stays young. So likewise for our career, our skills, keep it flexible. Companies has to be flexible, we have to be flexible, then you can stay young longer. Yeah. So if we can do all that, and likewise, if we keep ourselves healthy, we don't burden the young. So flexibility is also about knowing our limits as we grow older. We all grow older. As we know our limits, we keep ourselves young. I lived through, I'm 53 or 63, 10 years gap. I love my 40s. But now that in my 50s, they say 50s is the new 40s. So I'm still in my 40s. When I'm 60s, I'm sure 60 is the new 40s. When I'm 70, 70s will be the new 40s. So we'll always be 40. So just carry on and take care of ourselves. I do have one question, very serious one. You say in Slovenia, when you go to a rock concert, they are all above 50 years old. What band is that? It sounds like Guns N' Roses.
Actually, I had a visitor from WHO. I don't know if you know him. He's director of Observatory, European Observatory for Health Systems and Policies, Dr. Figueras. Maybe somebody knows him. And he was doing some great job for our presidency 2 years ago to European Union. And I invited him to the rock concert. It was actually punk rock concert. So to that conference, and she said, "What is going to be this? So, old people are over 50, and it's going to be classical concert." I said, "No, wait and see." And then it was punk concert, and he was like, "Wow!" And then he was so happy because the rock stars there, they were over 70, so older than him, you know. So look to Mike Jagger and saw him. Rock is being old.
I would like to invite Dr. Linda Fried, the co-chair of the International Commission of the Global Roadmap for Healthy Longevity, U.S. National Academy of Medicine, and Dr. Anshu Banerjee, Director of the Department of Maternal, Newborn, Child and Adolescent Health and Aging, WHO. And through their concluding remarks, perhaps they can identify for us a few major themes and next steps that are emerging from the statements that we could pick up perhaps after the event concludes. There will be time during the venue for some extra conversations, bilaterals, over some refreshments. So could I please invite Dr. Fried to give us some final remarks?
Thank you very much. Minister Ong, thank you for your leadership here as well as in Singapore, and thank you to all the other excellencies for your wonderful leadership. What I can do is speak on behalf of an 18-member global commission, which was brought together by the U.S. National Academy of Medicine, and 3 of my co-commissioners are here, Dr. John Wong, the co-chair, Dr. Mosa Moshabella, who is here from South Africa, and Dr. Anne Eritz, who is from Switzerland. We were charged by Dr. Zhao, who you heard from earlier, to say, how do we as a world understand both the necessities and the opportunities of longer lives, and recognizing that we actually, because of societal investments, particularly in human capital and health and education, have created these longer lives. We built this. It's what we wanted. And the challenge ahead of us is the huge gap between whether people are able to remain healthy through those longer lives or not. The inequities and wide inequities between people who are demonstrating that it's possible to live long lives with health and the people who do not have the opportunity to do that. And how we create equity in the opportunities for health and longer lives for older people while building a society so young people can live long lives with health. And at the same time, what are the costs of inaction? And the commission concluded, as did the Decade of Healthy Aging, that the costs of inaction are huge. They're the costs, of course, of rising costs of medical care in the face of longer lives with more ill health, unless we learn how to, across the life course, prevent chronic diseases and disability. But they're also the costs to the individual of long lives with health. They are the costs of what we lose if we don't design the society for longer lives that all of you are working on, where we actually can benefit, as was already mentioned, from the capabilities and assets that we all develop and accrue as we get older. And in fact, the science now is quite convincing that as we get older, we do develop capabilities that aren't lost the day we retire. Capabilities of expertise, capabilities of a lifetime of solving complex problems, capabilities of ability to actually recognize the problems that matter for the future, for future generations, and capabilities built on both a lifetime of experience and a lifetime of expertise brought together to actually solve conflict, to be able to bring together aspirations for the future with wisdom of what matters, and be able to actually better, in more even-handed ways, solve conflicts that people are confronted with. Older adults are also much more generous, it seems, than young people, much more pro-social, and the age group much more concerned about the future. So we've never had these potential assets before. How will we benefit from them? Well, it will require, and here I'm adding on to comments that were already made, but it will require both investing in what we now know, that long lives with health are possible, and democratizing access to that for everyone. And with health, building the opportunities for older adults to do what they want and what matters to them, which is to make a difference for the future. Across all societies, that's what we see, that older adults deeply care about, is ensuring a good future for next generations and having the opportunity to keep contributing through work. The opportunities our commission concluded are huge and unprecedented, but it requires actually transformational change, as was already said, in every sector. Building health systems devoted to healthy longevity so that we're not just providing cure, but we are investing across the life course in prevention. Building perhaps public health systems that we never imagined before to complement medical care delivery. Public health systems that deliver health across the life course through prevention at every age. And it will require actually building new societal institutions that enable older people like your father to keep contributing. The opportunities from the point of view of the commission far outweigh the challenges, but we have to really transform all sectors of society to be a society for longer lives. Thank you.
And we're a life course department, and I think that has just been highlighted as well, that we're talking here about well-being, but we're talking about well-being throughout the life course and why that is so important. Healthy aging starts already at preconception care. It's already an issue during pregnancy, early childhood development. Everything contributes to healthy aging. And what is important is the well-being at the end of life as well. It's not only getting older and adding years to life, but also adding life to years. And so yesterday I was in a meeting that addressed the well-being of adolescents. And there we had the voice of adolescents and how important it is for adolescents to actually be involved in what is being developed, what kind of programming is being done, etc. And I think crucial for us also, when we talk about healthy aging, is to really listen to the voice of older people, what they feel needs to be done, how we can engage them, how we can make our services age-friendly for them in order for them to be able to grow and keep on contributing to society. Because as we've also heard, it's lifelong learning. Learning doesn't stop at a particular age, and lifelong learning is very important for everyone to keep their mind busy, to keep their mind healthy. And we heard also from His Excellency the Minister from Singapore, it's a mindset issue, and we really need to address that. So last week I was in another meeting around well-being, and that was around maternal well-being. And we know that there's a lot of intergenerational activity as well, or engagement around grandmothers supporting their granddaughters during pregnancy, And so again, this intergenerational contact is very important. It's very important for us in society. And I think when we talk about aging, healthy aging, we need to make sure that we maintain that kind of intergenerational contact, intergenerational learning, sharing values, learning from life experiences. And it's very important, not only for the older people, but also for the older generation. And so I think that is really crucial as well. So once again, voice of older people, I think very important to include in our discussions and in the way that we start designing our programs and improving our health systems. So honorable ministers, thank you very much for joining us today, and distinguished panelists and other speakers and everyone here. As we bring the event to a close, I want to also thank everyone for sharing their lessons and for their political commitment, because as we've heard, it's not only an issue for a few countries where we have a high proportion of centenarians. This is an issue globally. We had a webinar during the COVID pandemic, and we had civil society organizations from Kenya, from Uganda, who were speaking about how this agenda is so important for them, for their people in the community. We actually recently visited Botswana to provide support for the strategy. We visited Cambodia to work with communities to talk about how to support healthy aging in the community. This is not just an issue for a few countries, higher income countries. This is a global agenda, and we need to make our health systems ready to address that. So we heard a couple of stories, and I think from Singapore, we heard that our social, economic, and healthcare systems are not really designed at the moment to meet the growing demand of an aging population. Really something to keep in mind. We heard from Kuwait that how to promote the continuum of integrated care in primary care that is respectful also to many social and environmental factors. From Costa Rica, we heard about the need to transform our cities to make them more age-friendly. And when we transform our cities to make them more age-friendly, it actually also benefits the general population. Because what does that mean? More green spaces, a possibility for older people to remain active, to walk. But that also applies to younger mothers with their children and to take their children to the park and play with them. And so again here, it's a life course approach, I think, that we need to really keep in mind, that when we talk about age-friendly cities, really keep in mind that we keep all generations in mind that link up with each other and can engage with each other in these spaces. We also heard from Slovenia about the issue of ageism, the rock stars. I think I'm one of the older, the 60-year-old who will still go to a punk concert. But we in our minds, we don't age, I think. In our minds, we still remain young. In our minds, we still think we can do everything that we did when we were 15 or 20 years old. And I think that was, also the point that was made, is that we need to remain young, and we shouldn't look at older people as if their minds have aged. In their minds, they want to still contribute to society. They still want to contribute to their family. They want to contribute to the well-being of their nation, etc. So our discussions have reaffirmed that investing in and transforming care and support systems require a whole of society approach. I think that was mentioned a few times. That will benefit all sectors and support us to respond to the diverse needs of older people. And so investing in improving care for healthy aging, combating ageism, developing age-friendly environments, not only benefit current generations, but also of older adults, but also future generations. And it also requires that future generations benefit from health promoting and preventive services throughout life course. Really, this whole life course approach is crucial. This will enable, of course, that older people will be able to age with dignity, with meaning, with value, and with rights. So the UN Decade of healthy aging provides us an opportunity to collectively think on how to do that, how to invest in that, and how to make our lives longer, but also healthier and with value and with dignity. And member states who have gathered here today are also demonstrating the benefits of doing so. So as WHO, we are committed to support countries in taking this agenda forward and transform the world to be a better place to grow older. I want to thank everyone once again. Thank you.